When people get their hearing aids, you cannot just let people go out into the world with hearing aids by themselves, just with the volume. The brain has to do a lot of changing, and so we spend a lot of time counseling our patients regarding what expectations they have when you have that first volume coming back. You have to remember, these patients may have not heard for 20 years, and so that system is not used to all this sound coming in, and so we have to counsel a patient and explain that your neural pathway, your hearing pathway in your brain, has to form again and has to come back. Most of that tissue has gone off and done sense of touch or sense of smell or other things, and all of a sudden the sound's coming in, and we have to bring that, we have to train and help the patient realize that this is a slow process for you to getting to use these hearing aids. And that's where that training that comes in. Mostly people have about that first 4 to 6 weeks is when they really begin to understand the benefit they have. It can take up to a year to really get used to hearing aids. And so that counseling regarding how to use your environments. When you walk into a noisy environment, where should you sit? How far away should you be sitting away from somebody? Should there be light behind your back? Do you need to look at somebody when they're talking to them? What kind of questions can you ask? How can we educate the family members? How do you speak to the person with the hearing aids or hearing impairment? What can you do to help that situation be more positive? That's all involved in that same education that we do. But 21 years ago when I started, a hearing aid was more of just an amplifier, meaning it amplified soft sounds, average sounds, and loud sounds all the same, and all I had is a little screwdriver that I could turn and adjust the volume. The problem with that is that it made soft sounds louder, it made average sounds louder, it made loud sounds louder. Things were not, it was too much volume for a lot of different situations. So today with our digital technology and the computerization, we can do a lot more to have the hearing aid actually mimic what our normal ear does, our natural ear does. And so what the hearing aids do today is they make soft sounds louder so you can actually hear them. Average sounds like my voice are now tolerable and average for them. Loud sounds can be reduced so they stay within their tolerance level and not get so loud. So that's the first thing. So we actually can customize that to the patient's needs from their hearing exam and see. They also nowadays do a much better job of helping in background noise. A lot of the hearing aids today have 2 microphones that are on the back, and one of those microphones allows the noise from behind the individual to drop down when they're in restaurants or places of noise, and so then they can hear the person in front of them much more effectively. So it does help in noise situations better that way. They also have the ability to, they're so fast nowadays, they're sampling sound 1 million times per second. So they're taking a measurement of sound 1 million times per second, which means that the word, for example, cat, C-A-T, it's so fast that it can take the noise down between the C-A and the A-T, so it drops that noise and so allows that speech to rise above that as well. So they really have come a long way. They're much more clear. They now have our thin-typed devices that you don't have the bulk of the plastic in your ears anymore. It allows the fitting feels much more comfortable, and you don't shut their ears down so much. They also are now working with cell phones, so you can have your iPhone or directly connect to your hearing aids. So when you take a phone call, the cell phone calls right in your ears. If you have a podcast, goes right to your ears. If you have like to play music on Pandora, then it goes right in your ears as well. So, and that actually, the iPhone actually is a microphone, so you actually can place that at the end of the table while you're having a meeting, a lunch meeting of some sort, and whoever's at the end of the table, their voice will go into that cell phone right to the hearing aids too. So technology is really changing quite dramatically, especially in the last 20 years, and not the last 5 years for sure. So with those improvements, we're seeing a much more satisfied patient with their hearing aids now than I have ever had this last 20 years, which is great, because we want these things to stay in their ears. The professionals that utilize the best practices for fitting a hearing aid, that begins with a very thorough exam, not only of speech in quiet with the patient, so they're hearing words in quiet, we're finding out how well they hear in quiet environment, but also with the noise around them. So we're finding out what their abilities in noise is. So when we actually do the hearing aid fitting, one, we can counsel a patient appropriately, because the problem we have with our marketing today of hearing aids is a lot of times they'll say hear the best in noise. You cannot use that terminology. Everybody's different in the way they hear noise. So when we do the fitting of the hearing aid, our patient will come in, the first thing we're going to do is begin to give them the expectation of their abilities first. That way we can help with expectations. After that, our patients will sit down with their family members, often are there, and we'll go through what the devices look like, and then we will begin to fit the devices into their ears. What we do specifically at this practice, and only about 30% of us that fit hearing aids do, is we have a very small microphone that we place down close to the eardrum. It doesn't hurt, tickles a little bit. We'll place that microphone down by the eardrum. We'll then place the hearing aid into the ear, and we'll have a speaker in front, and that speaker will begin to have a man's voice come from that speaker, and we are measuring the volume. The hearing aid is amplifying his voice. And so we call that real ear verification, is what we call that, real ear verification. And what that does is it not only measures the volume of sound coming from the hearing aid, but it also takes that patient's ear canal, their personal ability to pick up sound into the equation. So we know exactly what's happening in somebody's ear. We know exactly that we're matching their prescription right to the T where it should be. And the patient's seeing this all happen at the same time. So that also builds trust. I mean, it builds, and we want that. We want that trust with our patients, because again, this is, when it takes somebody 7 years to come in and see us, a lot of times, there's a hesitation, and that is, but the quicker we can, cure that and get people in, the better it is for everybody in our population too. So now, most hearing aids, Keely, that we have a trial period with hearing aids. So that's something that everybody should ask when you're getting hearing aids. Do you have a trial period? The state law in South Dakota is 30 days. And that means that if somebody pays something for a hearing aid, then they have to give back at least 10%, or the professional has to keep at least 10%, and they refund 90% as a state law. At professional hearing here, we do 75 days. And the reason why we do 2.5-month trial period here is the brain is not rewired enough in 30 days to really have that patient understand the benefit. So 2.5 months is a good opportunity for that brain to rewire, a good opportunity to get them in their environment to really see what that product is doing for them in their lifestyle. And then that's just the beginning. I mean, again, this is a process with hearing aids that we like to see our patients every 3 or 6 months afterwards, because it is something that the brain continues to change, and you want to be there with that patient and adjusting the hearing aid when it's needed to be adjusted. And they should be having their hearing screened at least once a year. It's not a bad idea either, just to make sure that if their hearing is dropping or changing in any way, that we readjust the hearing aids as well. A lot of it is based on the severity of the hearing loss. So the more severe, the different type of product we have to do. You may see people that have like an ear mole, like a piece of plastic in their ear, then the tubing comes up and then the hearing aid sits behind their ear. That is more for power, for people who need power, who have a more severe hearing loss. If somebody has more of a mild hearing loss or moderate hearing loss, we can do the really thin tube ones, the really thin tube that come up and sit behind the ear that way. And those are then more effective because they can still hear, if they have normal hearing in the low pitches, they can still hear that hearing without plugging their ears up, but we're giving them back the high pitches they need from that device. Sometimes we still make the plastic hearing aids that go inside the ears. Those are still made as well. To be honest, more and more are going to either that thin tube device or the power aids. So it's severity of hearing. It is also the person's dexterity. If they're having a hard time with their hands, we have to be careful. We don't want to give them a really small product. We want to give them something they can handle and use. Batteries are an issue. Today we have rechargeable hearing aids. So if people do have dexterity problems, we have hearing aids now that have a lithium battery that you plug in at night for 3 hours and it holds a 24-hour charge. So that's great for those type of individuals that may have some dexterity issues. That's mostly the thin tube devices that are out there currently with that. And I think noise is another thing. The more noise challenges they have, we have to look at the type of devices that they use to help give them the best opportunity to hear in background noise as well.